get going. Thanks. Well, good afternoon. This is our House Economic Stability Work Group meeting, and we're going to hear today from representatives from United Way throughout the region. This was one of the requests that the committee had from our last meeting. So we will, I guess, get started with that, unless anyone had any other comments they wanted to make before we got started. Okay, so this will be recorded and is part of our live stream, so we will be able to get to this information from the Maryland General Assembly's website later. So thank you for being here. And Grace or Emily, you want to start off with who's going to present first?
I've just started sharing the screen for Ms. Wendy Deese from United Way of Central Maryland.
Good afternoon, everyone. Thank you, Madam Chair, for allowing United Ways across the region the opportunity to share with you some of the highlights of what has occurred over these past 2 years as it relates to ALICE. So I'll just jump in and get started talking about some of the things that are occurring with United Way of Central Maryland. For those of you who may not be familiar with the ALICE report, ALICE is an acronym that stands for Asset Limited Income Constrained Employed. Basically, we're talking about the people who are struggling to make ends meet. The working poor is what we've previously referred to them as. In the state of Maryland, there are nearly 39% of our population is struggling to eat. Whoops, got ahead of myself. So here's those are a list of some of the partners who have supported and sponsored the ALICE report. Kaiser Permanente is the lead sponsor, and the others represent the various parts of the state who have contributed to and supported the ALICE report. And so, as I had started before, in the state of Maryland, nearly 39% of our population is struggling to make ends meet. That is nearly 2 million or 800, excuse me, 862,000 households. This number represents the 9 or 10% of those who are actually at or below the federal poverty level, plus an additional 29% of individuals who are not eligible for many of the benefits that those who are at or below the poverty level are eligible for. Part of the ALICE report that has been produced includes a ALICE survival budget. And so this next slide gives you a breakdown for what individuals who are in single households, senior households, and a family of 4. And when we talk about a family of 4, typically that includes 2 working adults and 2 children, one of them who would require daycare. And so, as you can see by this chart, it breaks down the components of the survival budget. The survival budget is not a thriving budget. It is simply the minimum that someone would need to access the bare minimums as far as food and healthcare and some of the other areas that are listed here. Technology represents the cell phone. Today, many people don't have landlines. Most people are now depending upon their cell phones. And so this represents the expense for a cell phone. And if you look at that dotted line, in gray, that is the federal poverty level. And so this just demonstrates the inadequacy of what many of the benefits are based on, in comparison to what the real needs are for people to survive in Maryland. In the next slide, we have created,
And if you look at the dotted line,
what
in
I'm
gray,
getting feedback,
that is
so excuse me, I don't know. Okay, fine. When we look at the Alice households by income, as it compares to the poverty level, you can see the differential between what the household, what the households are surviving off of based on the poverty level from 2007 to 2018. So you can see the disparity that exists from over those years represented here on this slide. We've created something that's called the Alice Essentials Index. The Consumer Price Index is just not keeping abreast of the real expenses. And so the Alice Essentials Index is showing you real cost as far as what it's costing people to live to access some of the essential basic needs. And so this is showing you our index. And here again, you can see the difference between CPI, which is pretty much the standard, versus what's needed for families to survive. And here, what we're looking at is low wage jobs, medium wage jobs, and high wage jobs. The fact that there are so many low wage jobs that are available to individuals, yet they're not necessarily meeting the needs of the individuals. And so this whole wage disparity is illustrated pretty well as far as the number of jobs are actually available versus the income that the individuals in those types of jobs would actually earn. And you should note that many of those who are in those low wage jobs are the ones who have suffered significantly under these current circumstances with COVID and everything else that we have gone through over these last few years. What I'd like to do next is just provide you with a real quick example of what a household may have lived through over the pandemic. And so if we look at this slide represents a family of four, two working parents between January and February of 2000. They had expenses that equaled $7,352. The income between the two adults was $5,857. And so at the early stages of the pandemic, they were operating at a deficit of almost $3,000. If we go to the next slide, we look at March when the COVID hit. Their expenses increased. The expenses immediately increased, and because of the type of work they were involved in at that time, their hours were cut by mid-March, and so now their income has dropped to $4,300. The expenses have increased, and now their cumulative debt has increased to $5,949. Moving on, by May, they are no longer able to continue to pay their childcare expenses. And so their expenses are at $5,661. Their income, because one of them lost their job, is now 29.28, and so their debt continues to exceed the expenses that they're able to cover with the income that they have. Moving on to by September, they were able to pick up maybe a little bit more hours, but their income is still low. Their expenses remain. And if we look at the cumulative debt that has accrued since the beginning of the year, since the pandemic, this family has really fallen upon hard times, and their needs are even greater than before. And I believe our last slide represents January to December. And this is just an example of what could happen to a family. And it's probably happening to many of the families who were before the pandemic struggling to make ends meet, but the situation just became dire as they reached the end of 2020, and it could go on and on and on. But $20,000 in debt for anyone is pretty significant, no matter what your income is. So now what we want to show you is who is really impacted, or how different groups have been impacted as a result of being Alice. And so, as you can see right here, Blacks have, are 50% of Blacks households are below the Alice threshold that we showed you when we were looking at the survival budget. The group that's most impacted, as far as Alice is concerned, are single female-headed households with children. Those are the ones that are struggling the most, that are subjected to the whole struggle to make ends meet. Next slide. This shows you how Black households fare as it relates to the percent who are below the threshold, 60%, versus white households, 40%. And so we've talked about how the pandemic has had an adverse effect on households of color, specifically Blacks. And here it is, showing you some of the factors and what the numbers look like. Moving on. Okay, so this is where we're going to switch sharing screens, because what we would like to do is show you a tool that we believe can be transformative for the people that we're serving in the state of Maryland. So just a few months ago, United Way of Central Maryland partnered with the Federal Reserve Bank of Atlanta and Richmond. The economist in Atlanta, Dr. Alex Reuter, created this tool. CLIF stands for Career Ladder Identifier and Financial Forecaster. And so basically, this is a tool that helps us illustrate to individuals who are seeking employment, who are experiencing financial hardship. It's a tool to help them anticipate some of the drops in income and be able to take a different look and a different approach to how they address their finances. And so for the purposes of this example, I'll use Baltimore County as the county, and the family type will go with 1 adult and 2 children. So this is just to show you some of the inputs, and we'll also be able to show you what it looks like as far as the graphs that we'll be able to produce. So for the purposes of this demonstration, and because we know that those who have children with childcare needs are the ones who struggle the most, we'll put their child at 2 years old. The second child we'll put in school at, let's say, 8 years old. still young enough to need some type of after school care. As far as public assistance is concerned, we're going to say that they are eligible for all the programs that, like childcare subsidies, the earned income tax credit, housing vouchers, everything that we make available in the state, this individual would be eligible for. You identify the industry that they are in, and let's say that they're involved with the construction industry, and specifically we'll have them as a, let's say they're a boiler maker. We can put in the type of training for the purposes of this example. We'll use the typical time that's required for that particular industry and put them currently at a near minimum income without without any credentials or any training. So when we calculate the results for this demonstration, we can go back up to the back and up to the top and show you some of the results that may impact this individual. I don't see it working right now. I don't want to take up too much time. Maybe if we get some time at the end of this presentation, we can go back and get it working for you. The purpose of what I wanted of showing this demo, here we go. I'll just do this real quickly. So this individual, their pre-tax income, if they were to receive the training for that Boilermaker position, would have them earning over the next 20 or so years about $52,000 versus if they stayed in that minimum wage job, their salary would not be much higher than what it was before. And if you look at the gray line, which represents the ALICE survival budget, the person who stays in the minimum wage job never reaches the point of sustainability, whereas the individual who has received additional training, their outlook as far as income is significantly higher. This chart shows the individual how their benefits will fare. So you see that on the right-hand side, that represents the individual who took the training to be able to advance their career opportunities versus the individual who stays in that minimum job. And so the individual who has received the training is able to be far better off than the individual who does not. This slide shows you the after-tax impact on the income for the household. And so really what we're showing you here is the benefits cliff that takes place over the course of their lifetime. The value of this tool is that as we're talking to individuals in job training and any other number of programs that they might be involved in, we typically talk to them about the career choice that they've made and the employment opportunities for them without being able to have that conversation about income. And it just changed the narrative as far as how we encourage people to really take charge of their careers and empower them and their families. And so when we look at this chart, it's showing you the total taxes paid by that individual and the differential between the entry-level job and the job after they've received training. And this shows you something that I would imagine that you are most interested in, and that is the tax savings that they will, the taxpayer savings because of the ability to advance their career. So we're able to change the conversation that we have with our clients that we're serving, especially in our workforce development programming. And we're also able to use this tool with those who approach us around housing or any other programs that we're engaged in. So I'm going to stop right here and shift over to Ken Oldham from United Way of Frederick County, who will tell you a little bit about some of the work that they're doing around ALICE.
Excellent. Thank you so much, Delegate Queen and the entire Economic Stability House study group. Thank you for the opportunity to be here this afternoon to talk a little bit, not only about Frederick County, but perhaps also what we're seeing in the rural communities of Maryland in this pandemic age that we unfortunately live in today. But I sincerely appreciate the opportunity to speak with you today. My name is Ken Oldham. I am the CEO of United Way of Frederick County. I've been a Maryland resident my entire life. I grew up in Tawnytown, Maryland, in Carroll County, and I have lived in Frederick County now for about 20 years. And I worked in Montgomery County for 15 of almost 20 of those. And now I live in and work, delighted to live and work in Frederick County, Maryland. I'm delighted to be with you today. Next slide, please. I want to speak with you a little bit about what we're seeing for our ALICE households, or our asset limited income constrained employed. The way that we typically describe these is these are working individuals who are unable to afford a basic cost of living. And what you're looking at here is over the last between 2010 and 2018, where we are with our ALICE household. So very quickly, the structure of these slides is the federally defined poverty level is in red. In that yellow orangish color, that's the ALICE, so below a basic cost of living, but above the federal poverty line. And then, of course, anything that is in blue are above the ALICE threshold. What we have seen in Frederick County, and this is reflected in many of our rural communities, is a steady growth between 2010 and 2016, with a drop off in 2018. And we will have, by this time next year, the 2020 numbers, which will reflect the COVID era of data. We have a COVID impact survey to help bring us up to speed. But unfortunately, it appeared that we were making some headway, at least in Frederick County in 2018. And we anticipate that, and we know, or waiting for the data, that the COVID-19 impact has had a severe effect on our ALICE households in Frederick County. Next slide, please. So as Wendy so adeptly acknowledged, that single mothers and single parents in our community are of equal concern as in the entire state of Maryland. We're looking at about almost 80% of single mothers in our community are unable to afford a basic cost of living. And I think all of us on this call today, and I think everybody in our community find that to be unacceptable. 80%. So we have been taking measures to help assist our single mothers to the best of our ability. And I'll talk a little bit more about those efforts here in a moment. Next slide, please. So the other thing that we often look at is our race and demographic information. And similar to what Wendy had said, we do have concentrations of ALICE households in Frederick County in the Black and Hispanic populations. For the first time, what's notable about this is for the first time we have seen a separation. While Hispanic and African-American communities have often ebbed and flowed at about the same rate and about the same size, when the 2018 report came out, it was the first time that we had seen a separation, with Hispanic populations now growing not only in the size of the population, but also in the percentage of individuals who are affected. The same can be said, by the way, about our Asian households in Frederick County compared to our Caucasian households. For a long time, they were neck and neck and moving forward at about the same pace. But our Asian households are now growing at a faster pace and percentage. And of all of these demographics, the Caucasian population was the only one to reduce. However, I want to go to the next slide. And this is representative of many rural communities. Because we are such a widely majority white community, consists to be so in many of our rural communities, when we have looked at the percentages compared to the total population, we find that still, even though 35% of Caucasians in our community are Alice, there are far many more of those than percentages of our households in color in total. But I want to keep that in mind, because when I get to talk about a little bit about the Prosperity Center, the actual use of our support programs is actually flip-flopped. And that's a fascinating trend that we're seeing and we're exploring further. But next slide, please. So we have done Maryland-wide, we did a COVID impact survey. This was our effort to see what is really happening among our Alice households. And in Frederick County, we took it one step further and we did some independent polling using the same researchers in Frederick County so that we can get a much better feel for how not only how we are affected, but how we're affected compared to how some other communities or the entire state may be.
No, people need to cut their teeth. It's the same, and you know what's so funny?
Okay, I'll keep going. So we are what we're seeing in Frederick County and is largely representative is that there are some major areas of need. So the question that was asked in this case is, which actions have you taken? What have you actually done? Lots of other polling, but this is the one we really look at often. What have you actually done to help mitigate the concern in your family? And I note that the only area in which above the Alice threshold, non-Alice families was above Alice threshold, and that was in none of the above. They have not had to do anything to mitigate the COVID-19 pandemic. Yet our Alice households are far more likely to have taken money out of savings, increased credit, applied for government assistance, borrowed money, sold belongings, taken money out of savings, taken money out of retirement. And the one that really hit us so hard in Frederick County and throughout the community, received food from a food pantry. Of all the things that we should be able to provide our community, it is the base and sustenance to sustain our bodies. So we have taken these into consideration in our programmatic development. It has changed the way that we think about Alice. It's changed the way we think about our support programs. Next slide, please. The one thing that we do also look at is we look at the geographic dispersion. So this can be often unique in rural communities, not just in Frederick. But we looked at the city of Frederick, which is about 27,000 households, and 50% of Frederick County household, the city of Frederick households are unable to afford a basic cost of living. And similar to that analysis, we looked at real numbers outside of the city of Frederick. And we have found that 44% of those 70,000 households are, but that 44% represents almost exactly as many as the total population of the city of Frederick combined. So what we have done a lot of work here in Frederick County is to do away with the notion that the poor live in urban communities. In fact, most of our working families are unable to afford a basic cost of living, actually live outside the city and in our beautiful countryside here in Frederick County. Next slide, please. The other major challenge that we have found in Frederick County and in many rural communities is transportation. This is the issue for us these days. We're spending an awful lot of time talking about it. Unlike in some major metropolitan areas, there is simply not a tax base in our rural Maryland to support a robust public transportation system. We're just not able to do it here. Public transportation just does not link Alice concentrated communities with the jobs that most of our Alice households get. We look at our public transportation maps. If we were to look at a map and try to move someone from Walkersville, Maryland, just north of the city of Frederick, to the industrial district of English Muffin Way on the south side of Frederick, where many Alice jobs are, thousands of Alice jobs, in most vast majority of instances, you can't do it. There is no public transportation system, no bus stops within a reasonable walking distance to those areas. COVID-19 has diminished the supply of ride-share drivers, so that isn't a viable option these days either in our rural communities. Generally speaking, the more rural you get, the less of these options there are. One-way MTA trains and commuter buses, if available at all, and many of our rural communities in Maryland are not serviced by trains and commuter buses. Their lack of availability reduces the availability of job opportunities for those that want to make higher wages or find jobs in our more urban areas. It just doesn't exist. And then they don't work on weekends and holidays, which presents even more challenges for our families. The reliance on the on private transportation, which is where we are. United Way has introduced a Pathways to Transportation program, which is trying to provide Alice families with private transportation so that they can find higher paying jobs. Unfortunately, we are encouraging private transportation, which means that they're going to have obvious implications on our environment. It is an issue that we're aware of. Our priority right now is making sure that our Alice households can survive this pandemic. And it requires in Frederick County and many of our rural communities, private transportation is an absolute necessity. Next slide, please. So what has United Way of Frederick County done to respond to this? We immediately launched our COVID relief campaign. Between that and our annual Unity campaign, we've raised over well over $1 million in support of Alice households in our community. We launched a United in Recovery campaign that is bringing relief to our Alice households on an ongoing and strategic basis. We have introduced free vaccine rides to anybody in Frederick County who needs a ride to receive their COVID-19 vaccine. We are about ready to introduce a Ride United program that is a much wider usage in Frederick County to be able to support individuals that need to get to jobs and do healthcare appointments and to the grocery store. Food deserts are a big deal in rural Maryland. And we've been focusing on our Prosperity Center Pathways to Financial Stability. Next slide, please. So Pathways to Financial Stability is our response, our strategic response to the COVID-19 pandemic and to the Alice issue. We have two pathways, a pathway to home ownership. We know that home ownership is the way out for many of our Alice households. The asset building and equity earning capacity of owning a home is life-changing for our Alice households, many of whom never thought they could own a home are sitting in their homes now. And we also have, as previously mentioned, have our Pathway to Transportation program, which provides resources for our individuals to obtain private transportation so they can seek higher paying jobs or get jobs at all. Next slide, please. I believe that is the end of my presentation, so I sincerely appreciate the opportunity to be here with you today. I'm available should you have any questions. Thank you.
And I believe that I may be up next, Madam Chair.
I think you are too, Rosie. Thank you.
Okay, thanks, Ken. So good afternoon, Madam Chair, and to all of the members of the delegation. I do want to thank you for this opportunity to join my United Way colleagues to be with you. I'm Rosie Allen Herring, President and CEO of United Way of the National Capital Area, which includes not only Washington, D.C. and Northern Virginia, but also includes two heavily populated counties in the state of Maryland, Montgomery County and Prince George's County. We can skip to the next slide. I do have to acknowledge our delegates who happen to be on this committee. First, our delegate, Andrea Harrison, who is also a very good friend, and we serve on the board of the Prince George's Community College together, along with Delegate Fisher, and I think I saw Delegate Chi from Montgomery County, and Delegate Valentino Smith. So for us in Montgomery and Prince George's counties, again, you've heard all about the ALICE population and what it means for many of our neighbors and our colleagues and our friends who are literally asset limited, income constrained, but employed. Many of them are going to work every day, but they are, again, at risk of or either experiencing homelessness, but also dealing with a lot of the economic insufficiencies that plague our communities. What we wanted you to see today in terms of Montgomery and Prince George's counties, what percentage of our populations were actual ALICE families. And again, they're struggling sometimes to just meet the basic needs. And you can see that nearly half of Prince George's County struggles to afford those basic needs. And then there is also a breakdown in terms of when we look at the 316,000 households and 370,000 households in Montgomery and Prince George's and Montgomery respectively. Of those households, 42% in Prince George's are at that ALICE level or the poverty level. And when you break it down even further, of those 42%, those households are Black households represent 42% of even that number, and Hispanic households represent 56% of just those who are literally working every day to make ends meet. When we look at Montgomery County with 370,000 households, with 34% of them meeting the ALICE criteria and poverty, if you will, 47% of those families are families and households of color with regards to Black communities, but also 48% are Hispanic households as well. And again, that's looking at the ALICE population as well as the poverty lens. We can go to the next slide. When we think about what's happened in the last 18 months, so much of what's come forth in terms of COVID, and I think we've all, none of us had a crystal ball and could see COVID coming. And when we found ourselves in the moment, no one could have anticipated that it would last as long as it has. And I think we can all recognize that it has simply exacerbated many of the challenges that were simply already there, but certainly where we find many of our neighbors finding themselves in need. And the number one thing that popped out at us over the course of this time was food insecurity. And we saw it in both of the counties that we're seeking to serve. And we know that when we look at the entire state of Maryland, certainly there is a challenge there, but it was particularly disparate there in Montgomery and Prince George's County, as well as, of course, in Baltimore. When we look at the slide, what it's sharing is the percentage change in the number of people who experience food insecurity just from 2019 to 2020. You can see in Prince George's County, many in the ALICE population were simply struggling to keep up, and that sort of kind of puts everybody in a precarious balance. Many are looking to try to stay on top of their bills, affording day-to-day needs for their families. Food became a choice of maybe you can and maybe you can't. It also begged a bigger question with regards to education, because then we became distinctly aware that many of our young people and many of our students were receiving their only nutritious meal in the school when they were no longer in that structured learning environment. So we had to come to understand that food insecurity was definitely the number one thing that popped up and that we had to leap into right away. And you can see again of all of the challenges in the state of Maryland when it came to food insecurity, Prince George's was number 1, Charles County was number 2, Montgomery County was number 3, and Howard County was number 4. We can go to the next slide. We just want you to know we're talking about food insecurity as an economic issue because we recognize that we need to ensure that our health of our communities remain. Otherwise, the viability of any economic solutions we can bring to the table may or may not be absorbed or embraced. And so when we look at what happened, basically pre-COVID, what happened during COVID, and we still very much are in that time frame, but where we still find ourselves even at this moment. And when we look at, again, Prince George's and Montgomery counties, what we're basically seeing from this slide is that we were certainly at a lower rate, but we were still above the average when we were pre-COVID in 2019. And then, of course, at the height of COVID, where you see that gold bar is where we were at the height of it. And then, of course, in 2021, even at this point, you can still see there's only been slight differences between where we were at the height of the crisis and where we even find ourselves today, when we know that so many resources have now been brought to bear. So it's still very much an issue. We see food insecurity as not only a health issue, but we also see it very much as an economic issue. We can go to the next slide. As we think about the household burdens, housing is perhaps the biggest economic indicator. As a former housing person for 21 years at Fannie Mae, I understand why housing is such a stability factor for so many families, especially those that may be in the minority communities. And when we see the housing cost burden for many of our families across the state of Maryland, we can see how sometimes it's just simply out of reach. And that sometimes is the number one cause of families being in poverty, because they simply cannot meet the goal of what we think is an ideal situation of 30% of your income being used for housing, when we know so many of our families are using over 50% of their incomes simply to have housing. And again, you can see where in all of these situations, from Prince George's to Montgomery to Baltimore, Howard County, against a Maryland standard, that we have quite a few households that are certainly above the 30%, but even more that are above the 50% for their housing costs. And let's look at what those housing costs are when we go to the next slide, and why it's out of reach. Again, when we look at the average income, because when we talk about the ALICE population, many times these are families who are going to work every day. It's simply what is the wage that is really needed in this particular jurisdiction and this area to truly have a thriving family community. And when we look at the two that I have circled here between Montgomery and Prince George's, we're looking at the wages in terms of what the minimum wage is for the state. We're certainly looking at what the minimum wage is for each of these jurisdictions, but what it actually takes in order for a family to rent. And in this particular scenario, and because we are data-driven and evidence-based in all that we seek to do, we try to make certain that we are able to understand what the numbers mean in terms of families. And in this analogy, it's literally for a one-bedroom apartment at fair market rent. We haven't talked about families. We haven't talked about multiple apartments in terms of multifamily. We haven't talked about, of course, home ownership. We haven't even gotten to that. This is just what so many of our families are up against, simply to try to maintain what we consider to be the most basics of housing needs. And so when you look at the number of hours that it takes at certain wages around the state, we can see that on average, it takes some families what we consider to be inordinate numbers of hours in order to be able to meet this basic standard. And when we look at, again, for some, if we were able to actually get it to a better rate to be able to support the housing costs, it could take you upwards of 101 hours and the state in order to be able to meet some of these basic needs. And of course, in Prince George's County would be commensurate with the state needing about 101 hours. And there is no one who can physically do 101 hours in the course of the week. We all know, even at the 68 hours and the 50 and 60 hour work weeks that many families find themselves having to deal with, that impacts the quality of life. If you literally are working every hour of the day, where is your family life? Where is that balance? How are you able to deal with childcare? How are you able to have anything other than working that hard for that long, for that number of hours to simply meet the basic standards? So it says that from an economic standpoint, we have a long way to go. And not only just looking at a livable wage and what that means for our families, but also understanding our cost of living, perhaps compared to the rest of the state, and what it means when we say that we are in one of the highest salaried areas in the country, but then we recognize that not everyone has the ability to be able to take advantage of many of those higher wage jobs that then will yield the success that so many of us look and choose to tout from time to time. Again, today's presentation was to bring this to the forefront of just sharing how the United Ways are working together to try and bring this to the forefront. We can go to the final slide. And at your United Way of the National Capital Area, we simply seek to look at economic security from a standpoint of looking at health, education, and the economic opportunities. We are a place-based strategy where we look at communities and try to meet the needs directly with them. We are addressing racial disparities and barriers that are there. And again, many of them from an equity standpoint have been there for quite some time. And so we do look at that from a systemic level as well. Again, as I said before, we are data-driven. You can see that with many of the slides that we shared today, and we wanted to be respectful of time. There are a multitude of sources to demonstrate how we look beyond what we know or what we believe we know to ensure that it's evidence-based, so that the solutions that we're bringing forth, we want to be able to say we're moving the needle on a particular issue from one place to the other. And again, we are results based, and we want to ensure that everything that we're putting forth is we're able to speak clearly of how it's supposed to help these families and be able to measure with those metrics how the impact that we're seeking to have, whether or not it's coming to fruition. Again, for us, our program areas are health, and you can see, again, many of the areas of specific programs that we have going on. We've also seen, of course, over the course of the last 18 months or so, that mental health has become one of the #1 health-related issues, and a drastic increase in mental health challenges, drastic increase in domestic violence, drastic increase in child abuse as well. And so we are working directly with a very myriad of sources to try to bring solutions to make certain that the outreach is done in a way where it's trusted advisors that are bringing this information to bear. Under education, we work very closely with both of our jurisdictions around middle and high school success, because we believe, based on the data, that if you leave middle school on grade level with the academics and social supports, that you're 4 times more likely to actually graduate. And a lot of times when we're looking at graduation rates, because we want to determine whether or not families are or individuals are college or career ready, you start counting them in the 11th grade, and most dropouts occur in the 9th and 10th grade. So your numbers are skewed before you even begin to count. And finally, when it comes to economic opportunity, we have committed from now 6 years ago to open 5 what we call financial empowerment centers. And we have all 5 open. And that first 5-year community commitment ended for us June 30th of 2020. July 1st of 2020, we started our next 5-year community commitment. And we, in those, similar to Ken's prosperity centers, our financial empowerment centers are one-stop shops where anyone in the community is able to access those resources and services free of charge, and to ensure that they can do everything from, of course, having volunteer income tax assistance, but also helping them with budgets, helping them with credit, getting to mainstream banking services as opposed to the fringe lending that we see from time to time, everything from check cashing places and title loan companies, because many families in our community use these entities as their actual banks, where the fees are almost insurmountable, if you will. And so it's a matter of bringing those to bear. We're very proud of this work. We will continue to do it as long as we need to. We want to, at some point in time, work ourselves out of a job, but as long as there are needs that need to be met for our community, we will do our best to meet them head on. And so again, I wanted to thank Madam Chair, as well as your entire committee, for the opportunity to be able to share even a little bit of this. We can go to the next slide, because if you do have questions or follow up regarding anything that's being shared, I do have my colleague, Ian Gordon, who is our Vice President for Community Impact and Engagement, with me today. And we want to ensure that we answer them for you, but we look forward to even greater and more impactful partnership. Thank you again. I think I yield back to you, Madam Chair.
Well, thank you. Thank you. This has been certainly very informative and eye-opening for me, and I'm sure my colleagues. So before I start to open it up for questions, I'm going to ask a generic question, and you can answer it as you start to think about your responses as other people bring questions. But one of the things we see when we do have these presentations across the state, that the needs are very different. And so it's very hard to have just a one-size-fit-all sort of legislative approach. And so I would like, if we could, because we have been trying to look at legislation in categories, and maybe as you think about some of the needs, and even if it's not today, but at some point, you can talk to me about that or talk to the committee about that. But if we could do one legislative thing, and I'm gonna give you the categories, I would like to know what you would like us to do. So in the area of housing, what would be that legislative thing? In the area of childcare, what would be that legislative thing? Again, this is looking towards 2022, what we're going to do. We can have an agenda where we look at things for multiple years, but we want to tackle some of these big issues that keep coming up every year. In the area of food insecurity, so we've got housing, childcare, food insecurity, transportation, and the fifth one I'm going to say would be training. So those, we would like to hear back from you now. We can talk to it or later on. But now I want to open it up to my colleagues for questions. And I see Delegate Juanita Fisher with her first hands up.
Thank you, Madam Chair, and also very proud to call my soror. It's so good to see you, President Allen Herring. I'm always just so impressed by you, and sorry I don't have my camera. I have a big event this evening, and well, we are live, but I don't mind saying I have rollers in my hair, so I don't mind telling the public that. My question really, there's been a bill, I believe Delegate Brooke Learman has carried this legislation, as well as Delegate Acevedo, about universal basic income. It's been piloted in certain municipalities throughout the country. I'm not exactly sure which ones. I just wanted to ask United Way's perspective, if you think that's something we as a legislature, we should be pursuing in a pilot basis. Do you stand behind that concept and your thoughts on that? Because I can't speak for my colleagues, but I don't know, I think we want to address so many issues, but we want to also just keep people from living on that cheater line, right? And how we can get people out for a generation and then the next generation out of poverty. So just wanted your thoughts on that, and all the subjects that Chairwoman Queen brought up as well were my same areas.
So this is Wendy Deese. From United Way Central Maryland. The Baltimore City has actually joined the Guaranteed Income Pilot. And so I serve on that committee. And there's a couple of things that have come up as a concern for many of us on the committee. One is we're very sensitive to the impact of these additional funds on other benefits that individuals and families might receive. There are clearly some that will be impacted, but we don't want to do anything that will harm the family by receiving these additional dollars. The other thing that that we should be aware of is, it's just for a short period of time. And without having a plan to maintain this, in some ways it can hurt people. And then the third point that I will make is, and I've heard this comment from some, we're already kind of sort of doing that with that additional dollars for the children, for I think it's $300 for the first child and $400 for the second or whatever. We're already kind of sort of doing that. And so maybe we should take a look at that and how we might maintain this. It's not cheap by any means. It's not cheap. And there's got to be a way to maintain funding, sustain that. And I'll respond to your questions as I think about it, Delegate Queen.
If I may, I might jump in. I would say that if we were to go that route, we would have to do it very, very carefully, and there would need to be adjustments made elsewhere. So we have spent a lot of time at United Way Network talking about the benefits cliff, and a universal basic income may artificially push a number of families off the benefits cliff. So before you could even consider a universal basic income, there would have to be a restructuring of the federal support mechanisms to ensure that we are not indeed making life a lot worse for our families than better. And I agree with Wendy, the child tax credit and the earned income credit are among the most powerful tax tools available to us to ensure that the families who need it are getting the support that they need and deserve. Thank you.
And I don't know if my colleague Ian wants to weigh in on any of these, but in terms of the wage piece, I too concur with my colleagues, with Wendy and with Ken, that in looking for the universal based income, we have to make certain that we don't have unintended consequences. We don't want to harm any of the families because we come up with what we consider to really be an artificial poverty line that now says, oh, it's magically this number now, whether it's applicable, whether or not it's something that can really happen in a high cost area, such as those that are surrounding the capital area. I do want to go back to Delegate Queen's questions around legislation on the key areas. Housing will always be, I think, a key legislative issue, simply because, every aspect of what we need to do as a community and how do we build thriving communities really emanates from housing. And as I shared earlier, I spent 20 years doing housing. And, at this point, it's affordability, sometimes affordability, home ownership. And then now that we find ourselves in a crisis, it's eviction protections and many of those legislative efforts that have been put in place either via the CARES Act or, the mandates that were there, but also, even at the federal and state levels. I think we have to somehow look to maintain those because, again, for many of the issues, they were already there. If someone was literally up to the edge and the pandemic has simply pushed them over, that meant that things were not stable to begin with. And so we have to figure out what stability means. We talked a little bit about the childcare issue. That is very much a deciding factor for many in terms of workforce, which was one of the pieces that you talked about when you said training at the end. And we all have recognized the statistics that have come from COVID that women have borne the brunt of the challenge with regards to being out of the workforce because of COVID, because of those choices that had to be made for families. And again, for food insecurity, it's about knowing where we have food deserts, but also recognizing that many of the individuals who've taken advantage of the food insecurity resources that have been here, many of those families were working every day. We found that many of our donors, found themselves in the midst of now needing because they may have had the types of jobs that were heavily impacted or disproportionately impacted by what's happening now. And we've seen that over time. We talked about what some of the crises are that we try our best to stand up and be ready for, everything from 9/11, everything from, when the federal government shuts down. And of course, now even with COVID and having the emergency funds there, many times we've seen many of our donors now find themselves standing in those lines because it's a choice of how we allocate those resources, very scarce as they are, as to where we are and what we mean. And again, just recognizing that so many of our colleagues and neighbors and community members are literally that one paycheck away or that one emergency away in terms of being able to really and truly maintain that family stability. I know you mentioned transportation. There's a whole lot there, but I don't want to monopolize the time. But I do want to make certain that we addressed your challenges or what we should be doing and looking at legislatively across the board. So thank you for that.
Delegate Fisher, is this a second hand or?
It was, but I don't want to monopolize my colleagues. So
Well,
I
let me see.
can put it in the chat for you if you want.
Well, let me see if we have anyone else who has a question then, and if not, we'll go to you. Anyone else want to ask a question right now? My colleagues? Mark, you look like you're pensive. You got any question? No, you good? Okay, Delegate Harris.
May I just make a comment? It's not really a question, but rather a comment. Certainly, we've been talking about this for a while, and while the information that was presented today I guess were things that we knew conceptually, but it was interesting to see it in writing. So, you know, I'm in Prince George's County and we're lumped into the National Capital Region. And so I believe that oftentimes we, you know, in some of these conversations, maybe I shouldn't say oftentimes, but sometimes, you know, because we get lumped into the to the National Capital Region, where sometimes some of the information seems like it may be a little skewed. And so to see in the presentation with the numbers that was presented, particularly for this region, it just really, it was impressive, and yet it was saddening at the same time to see that so many people are just hurting so badly. And you know, like I said, conceptually, we know these things, but to see it in writing is just a different level. And so I just wanted to say thank you for the presentation. And I'm very glad that we were able to have all of our partners here across the state for the United Way to share with us. Thank you.
Thank you. I think that was very good information, certainly very eye-opening. Okay, Delegate Fisher, we'll come back to you.
Thank you, Madam Chair. Sorry to monopolize. I just wanted to also throw something out there. And I've spoken with Delegate Harrison about these concepts as well. But I was wondering if you all had any suggestions or ideas, especially when it comes to like housing, and then we come to food access issues. If you've heard of or know of any best practices to help get our commercial or corporate space working towards these goals as well in the private sector. If there are ways that we can help encourage a private sector economy to address our housing needs, and a private sector economy or a bill or a certain structure or incentive or something on the food access. So those are like my two areas that I would love to know if you all know of anything or could lead us on any path. In my view, you know, I think there are things that obviously the Madam Speaker and the MGA want to do on a government side, but I would love to see us set up our economy in a way that it can also contribute to addressing these issues.
So thank you for that question. So we at the United Way Network happen to do pretty well with our corporate partnerships. So we have some experience in this area. I think Rosie and Wendy will agree. There are some really wonderful models in the network. I mean, our role is, okay, so I'm out in the communities talking every day with our corporate partners. I have yet to find one out there that doesn't want to lend a hand and get their employees' hands dirty to give a hand to help the fellow community members that may or may not be employees of theirs. Let's face it, many of our companies hire and retain people who are among our Alice households. There's not one that doesn't want to lend a hand. There's not one that isn't willing to get to commit some corporate dollars to give that the help. So our role in the community as a United Way Network is to help engage those employees and bring those resources to bear in a coordinated fashion and a way that brings outcomes, measurable outcomes and results for the betterment of our community and for the advancement of our Alice households in our communities. I would answer that question, Delegate Fisher, by saying the United Way is here to help.
And if I might also add, I think, you know, it really is the coordination, as Ken said. You know, when we think about our financial empowerment centers, you know, folks are coming in needing a variety of different supports. And I appreciate you know, calling out each of these areas on its own, but what I would suggest to the panel is to really think of those as integrated and think about how one really pushes against the other. Because when folks walk in, they come in with a variety of barriers that they face and a variety of needs. And so as we think about housing, it's closely linked to food insecurity, very closely linked to training, it's also linked to housing, to transportation. And so as we think of these issues, I would just encourage you to think about them, not in isolation, but how they're impacting each other. And certainly, whenever possible, having a one-stop, place that folks can go to and get a variety of different supports seems to really streamline and take care of some of the concerns around whether it's transportation or localities. So.
Thank you.
So,
Go ahead, Ms. Dees. I'm sorry.
oh, okay. No, I was just going to say, we were in a meeting earlier with one of the congressmen who was asking us about the ERAP funds that have gone towards eviction prevention. And the thing that stood out to me as I was listening to my colleague, and every time you hear the story, you hear more. The processes have to be simplified. The application processes that nonprofits have to go through to access dollars that are designated for specific things are complicated. In Central Maryland, we're working with the jurisdictions in our area to help move those dollars to help folks or to prevent evictions. And so many organizations are so afraid of the audits that come as a result of government grants that some of the requirements that are placed on the individuals who can actually benefit from the legislation is just overwhelming. One jurisdiction at one point had 11 pages that someone had to fill out in order to receive the funds that were allocated for eviction. We've been able to simplify that into 1.5 pages, but it's just the complexity of what's required of our residents, and also the fluidity. And what I mean by that is that whether it's housing, whether it's food insecurity, health, or whatever, they're all interconnected. When you start talking to the individuals, it's not just that they can't make rent. They can't make rent because they're not making enough on the job. And they're working the job, the hours that they do, because they've got to address the childcare issues. And I believe that we have siloed our work to the extent that we can establish the fluidity that's necessary to really be able to address the issues and change the dynamics for those individuals who are living as Alice or who are living in poverty. So, regardless of what the issue, we need to make sure that we simplify the process and that we, for the dollars that are allocated, get them out of the state's coffers into the hands of the nonprofits. Oftentimes, the dollars, lag behind the work that we have to do. And so that's kind of addressing all of the issues that you asked us to comment on, the simplification of the processes, the actual distribution of the funds, and to try to bring down some of those barriers that present themselves and keep us siloed in the work that we're doing.
Okay, thank you very much. That was very helpful. Yes, Delegate Chang.
Thank you very much, Madam Chair, and good afternoon to all presenters. Great job on the presentation, and thanks for all the details with regards to all the different areas that are in need. Specifically in the area of housing, there was much data and also information about renters assistance. And my question is, are there any data available as far as homeowners who have mortgages and what type of situation they're in and how we may help from a public policy standpoint in helping families who have mortgages. Thank you.
Delegate Chang, yes, there is a lot of data from a number of different sources that will go through and share with us about homeownership and what it means, not just, of course, the biggest statistic that everyone sees is the statistic around what's the desired level of income that should go towards housing, which is 30%, but that's in an ideal world. We know that so many of our families, especially with lower wage jobs, are certainly spending more than 50%. And of course, what does it take in terms of the wage? But then when you look at home ownership, which is another whole piece, you know, not just affordable rental, but affordable home ownership. And because we know what the sustainability means long-term for families who are able to actually have home ownership. We all know that's where families generally can educate their children. That's where they can start small businesses. It's the equity that's built in the homes that allows families to be able to leverage, to be able to do all of these things that we call the American dream. So yes, we can get you additional statistics around the types of mortgages, you know, what we need to do for many first-time homeowners. How can they get to the table in the first place? Many have been renters for a long time. We have to look at the number of families that we have in public housing. Many times it's generational, where they don't even think that it's possible because no one in their immediate sphere owns a home. What does that mean? How do you get the mindset prepared for that? And in order to be able to see, you know, where that opportunity lies, people have to see themselves in it and believe that it's actually possible for them. And when we talk about the eviction protections, you know, that came up, again, that was affordable rental. There's always a public policy, I think, good discourse around affordable rental versus, you know, home ownership. But I believe no one will have a qualm understanding that everyone deserves a safe, affordable place to lay their head. And so we just want to be able to talk through that, and certainly we can share additional data and follow up with you as well. Thank you for that question.
Okay. I have a question I think I want to direct to Ken. I was actually just talking to Delegate Curry yesterday about transportation in Frederick. And so what could we do? What would you like to see us do, I guess, is to help?
Well, us is a big question, so I can tell you what we're doing.
Well, the state to do. What
Yeah.
legislative things can the state do to help?
Well, you know, the funding mechanisms flowing through the federal government and through the state are rather complex and confusing. I don't know entirely all the nuance. What we need, I'll tell you what we need, and then you all have to figure out how to do it, is we need a more robust public transportation system in Frederick County. We are defeating our own objectives by relying on private transportation in rural communities. If our intention is to be less reliant on fossil fuels and to be cleaning our environment, to be in a position where our families are forced to purchase a car or not get that promotion or find that higher paying job, then we are being counterproductive. So I would suggest that an investment in rural communities into a robust public transportation system is not only good for our families, but needs to be part of a greater environmental protection program.
Okay, thank you. We'll work on
it. No small problems there.
No, thank you. But we do need to do something there. Any other questions? Delegate Shi, Delegate Moss. Delegate Harrison.
Have there been any, I don't know the Frederick area that well. I know that there is some urban areas, and then Frederick County obviously is more rural. But have there been any real conversations though about the public transportation piece with the delegates or with the legislators in that area? I know on my committee, I sit on the Environment and Transportation Committee. And I don't think we have anyone from Frederick per se, although we do have a few people from Western Maryland who are on that committee. And I was just wondering if there has been any discussion with them about public transportation.
Absolutely. So we've been doing the Alice project now for, geez, Wendy, remind me, 8 years, 6 years, I think. And we have what stuck out to us from the very beginning is that there were 3 primary pressures on our Alice households: housing, childcare, and transportation. And we have been shouting from the rooftops on those three items. Well before anybody thought that a pandemic could be possible. And what are the 3 areas that most of our Alice households in our rural communities, where are they most affected? We'll add in health, but also housing, transportation, and childcare. Our Alice families have really been seriously affected in those 3 areas. I think it's time to begin that conversation. I can tell you that in Frederick County, that a large-scale transportation conversation is actually being led by one of our private family foundations, the Osherman Family Foundation. Here is leading the way and helping to fund some larger scale study here in Frederick County. The greater funding community, including United Way and the Community Foundation of Frederick County, are fully engaged in that activity. So I think Delegate Queen was right. There isn't a one size fits all in any of these larger scale questions, because obviously especially when it comes to transportation, our rural communities are going to be in a different position than some of our more urban communities, and solutions here aren't going to work in urban communities, and solutions in urban communities aren't going to work well in rural communities. So I think it's not only a question for elected officials, but a question in partnership with the greater funding community and with the private sector. We are all affected by the transportation issue in Frederick County, including the private sector. Perhaps most significantly affected because their employees can't. Absenteeism is skyrocketing because their employees can't get the jobs.
Thank you. Delegate Shi?
Thank you, Madam Chair. Sorry, I was not showing my face earlier, but now I hope you can see me. First of all, I really appreciate this very in-depth, robust discussion on many aspects of poverty and the struggles. I know these are legacy issues, not easy to fix, and various communities and counties. I used to work for Montgomery County. Even supposedly the wealthiest community has many layers of struggles, even within my district, which is among one of the wealthiest. So my question is, I'm not sure if that's a question for you all leaders in the community and advocates as much as for ourselves as legislators, which is it this group's mandate to come up with a comprehensive strategy to tackle these issues so that they are aligned? Just because I want to respond to the point that Wendy made earlier, and you all made great points in different ways, but what the point Wendy made was really resonated with me in terms of helping people navigate the maze of accessing those resources. Because that's an issue that, as an immigrant, I can tell you is a huge issue with immigrant communities whose first language is not English. But also, with local born Americans, it's still an issue just to navigate government and knowing where the resources are and how to apply and how to make sure our system is connected and streamlined. I think a few years ago, Montgomery County developed a system within our HHS department so that there will be one point of contact for people who need multiple access. And now in my district, there's a up-county hub where the regional services center is also a food hub, is also where people can get access for vaccines and other health information and all of that. So that kind of layering up is the way to go. I don't think this group can, in the short term, tackle multitude of big legacy issues like housing and transportation all at once. But if we could have a pilot program that could show some results that we can implement with a reasonable amount of resources to show the efficiency of that kind of alignment, I think that would be beautiful.
Let me say a little bit, so as a part of background, I think that'll help Delegate Chi and others too. So, the House Economic Stability Work Group, I guess we were formed in 2018, 2019 timeframe. But when we were formed, one of the things we did was do what we called a listening tour to all the regions in the state. So we met with various community groups and advocacy groups to talk about what are the barriers to economic stability, and so we heard the things about housing, we heard childcare, we heard transportation, we heard training, and so we heard all those things and have tried to address them, legislatively. I mean, we don't have a comprehensive, economic stability bill, but we are doing, we're looking at things around housing, we're looking around things around childcare and so forth. What we did do, because we've heard this issue of one-stop shop, was try to use the model that we saw, I think it was in, I'm not sure which county it was, that was this, what they call the 2-gen model, where they are trying to stop this generational poverty. And in that, and so we now have at the state level, this 2-gen office, it has its own secretary, and its goal is to, again, be sort of bring together all the resources so people would go to one place. They would have these navigators. And so we should have it on one of our next meetings is to have the report for them from that 2-gen group to talk about what are some of the legislative actions they need from us, including funding or whatever sources. But part of that what we're hoping to see out of that would be setting up navigators, setting up places where people can get some help with benefits, to understand that if you get this benefit, you may be going into the benefits cliff, and these are sort of the things that you need to be leery of, or just to help navigate people through this process. So that is the intent of sort of this work group, is to kind of help to put infrastructure and resources in our communities to be able to address these issues. Again, as you said, it's been stuff that's happened for a long while, and I think our groups sort of got, things got ended with COVID, and we had to kind of folks had to focus on immediate types of needs. But that, I believe, is the intent of what the 2-gen approach was to do, was to bring together resources and get them out to people. But in that, there's still other things we can bring together as part of this committee. We are planning to hopefully do a bill on childcare, because that was one that we had looked at before and we weren't able to get past. We are looking to do something in housing. And so the thought is, what will those things be that we will do at least in 2022? But hopefully we will, this committee will be in effect for a while until we start to get a handle on some of these issues. But I hope that kind of answers kind of what we're trying to do with the group and how we work with the groups. Yeah.
Could I add one more point, which is, I'm sorry. I hope.
Yeah, go ahead.
I really hope, I know this group is called economic stability, but to me, an important component of economic stability is economic empowerment. I think today we have been well exposed to some sets of issues that were worsened by the pandemic or exposed by the pandemic. I would love to, for future briefings, understand what programs are working well or not, which programs should be enhanced or should be reevaluated or whatever, because I would love to hear solutions, how to empower our people to build equity and wealth.
Understood. I think this is where we can help to drive that, get those answers. So I appreciate that.
Madam Chair,
Absolutely.
may I share something? I heard someone ask about examples that you might want to look at or consider. And I was reminded of a trip They have the Baltimore Workforce Funders Collaborative that we participate in. And we went up to Cincinnati, I think it was around 2018. And we had an opportunity to visit a facility that's called City Link. And it was intentionally positioned so that it was in the center of the city within 10 miles of the poorest neighborhoods in the city. And in that, at that site, they had folks from housing, they had folks from transportation, training, health. We talk about one-stop shops. Our one-stop shops have attempted to integrate services, but it's not as effective as it could be. CityLink it was a private-public partnership. The only public group that was in there was the health department providing dental care for the residents, but there was only one intake that took place. And then that information was dispersed and it was like a triage. And so people could listen, or they could identify, where does this person need to go right away? And from there, the pathway was clearly outlined so that they could go from, addressing the initial issue to the next, to the next, to the next. So when someone asked about an example, that's probably one of the best one-stop operation. Don't call it that, please don't, because I think sometimes it can be a barrier for people accessing it, thinking that they're going to get all the help that they need, and they don't necessarily. But that's the one place that I saw that was most effective, and you just might want to take a look at it.
Madam Chair, if I may, just very quickly to Delegate Chi's question regarding, where there are some other best practices. We'd love to, my colleague Ian Gordon is your constituent in Montgomery County, and we can talk about the up-county hub that you have there and overlay it with what we are doing with the financial empowerment centers that really and truly try to bring families together. So I think there is some synergy there that we can perhaps share with your office as well.
Okay, thank you. Delegate Chang, is that another hand?
Yes, ma'am.
Yes.
Thank you very much. This question is with regards to food distributions that was discussed earlier, and this is an anecdotal observation from Anne Arundel County that I've observed over the past 20 months, especially since the pandemic started and through it. There's been many pop-up pantries, pop-up food distributions, and from my observations, there are a lot of small groups or groups that are in their infancy stage that are starting out. They want to help, they want to serve, and they want to do their part in the food distributions and supplying other toiletries and basic needs. I just wonder, do any of the panelists have any thoughts on how effective the pop-up space is, or if there's a way for these different groups to build synergy and resources to help them be more effective in serving others? Thank you.
So the pop-up services have proven to be helpful in the short term. It's bringing resources to the community where they are. For the long term, however, it hasn't shown to be as effective. As we're talking about hubs and one-stops, we should really think about kind of place-based activities that are in neighborhoods. We need to think in the neighborhood level. And so to bring resources to the neighborhood level. Sustainability, however, is key to those smaller organizations who have come together to really address an issue in the community. But what they do need is sometimes larger, more established organization to help support them as they support the community and get on their way to doing that. So in a true collaborative nature, really is important to ensure that these smaller organizations are connected to other organizations that can support them as they provide services in place in the neighborhoods.
Okay. Any other comments or questions before we kind of close out? Okay, so I want to thank everyone for your presentation today. I think it was very, very informative for our team. I'm assuming the presentation will be available for us to distribute to our members on the committee. Okay, so we'll get that distributed to folks. So I do want to make sure that the committee too kind of get a sense of why we're meeting and what are some of our goals. So again, our goal is to try to get back into the intent and role of the of this economic stability work group, and for 2022 to have some legislation that we will sponsor as a committee. It will be sponsored committee legislation. What we talked about before would be that we would do any sort of additions or enhancements to the 2Gen Commission. So we're waiting to hear their report and recommendations, which my understanding isn't available yet. So we might have to schedule that for a November meeting. And we talked about the idea of doing legislation around the issue of childcare and childcare affordability. A bill that we had sponsored as a committee before was patterned after the Child Care Working Family Act at the federal level, where which didn't pass, but hopefully we'll have better traction in this administration. But the intent is that looking at low and moderate income of families, that if their childcare expenses is more than 7% of their income, that they would get some sort of subsidy. So that's sort of the intent of the bill. We looked at it from a state level where we would, I think we put ours up to 10% and then get some subsidy. But something around that is sort of what we discussed last meeting, would be sort of a child care type of legislation to support this effort. But as I put out to the members from the United Way, and as well as others here, we still want to see things around housing, around transportation, food insecurity, and some of the issues that have been mentioned. So any ideas, any best practices you may have seen in other states, please bring that to us so that we can consider it as a bill to support the issue of economic stability for Marylanders. So that's all I have. Hopefully, again, we will be talking more in the November timeframe as we try to hash out what legislation we'll put forward for 2022. But any comments and questions you have, just send it our way. Again, we want to thank the participants here for coming out and giving us very informative information, and certainly want to thank our support staff, Grace Penderson and Emily Haskell, for their support with this. So any issues or questions you can send to Grace or Emily, and we will probably meet again, the committee, not the United Way folks, but the committee will probably meet sometime in November when we have the reports from the second generation commission. It's actually called the commission. Anything else? Thank you all for your time. Again, thank you. This was very informative. See you later.
Thank you for the opportunity.
Thank you.
Take care, Wendy.
Thank you.
Thank you. Be well.
Be well.